Guideline changes to the COVID-19 booster vaccine may be causing some confusion for many who want to get it. So our health educator, Dr. Griggs, joins us this morning to discuss this vaccine, the booster impacts. And Doc, this is a very confusing time to be following public health. A lot of things are changing. So we should probably kick this off by saying if you're confused, you're not alone.
Yeah, it's absolutely normal to feel confused right now with everything really morphing and changing right before us. The best thing to do right now is to stay in contact with your healthcare provider. Stay tuned as things evolve, and then talk to your pharmacies and pharmacists. If you have a pharmacy that you usually go to, find out what the updated regulations and rules are, if they're available, and even if you need a prescription.
Exactly. Okay, so we've got that blanket out there. Let's walk this back a little bit. We know, of course, we've all lived through the COVID-19 pandemic. Nobody's trying to go back to that, but here comes this debate about vaccines. What are the latest guidelines from the CDC, and how is that matching with some of the other doctors in your community, and what is everybody saying?
Well, the thing is, the latest are it's recommended for people ages 65 and up, and those with, there's a litany of other health conditions that still cover about 260 million people. Out of the 330 in the United States, the big group that's left out are the children and healthy adults, healthy kids and healthy adults. But again, talk to your doctor specifically about whether or not you meet the criteria for getting a vaccine and how.
All right, let's go back to the basics of vaccines as well, because, you know, there was a lot of talk when this one came out, you know, tested quickly, and people didn't have a lot of trust in this process. What have we learned now that we've gotten a little bit of space from COVID-19 proper and we can see a little bit more of the science?
So we do know that vaccines save lives. We've been doing it for eons, decades, hundreds of years, actually. But what's happened is that with the recent regulations, they've banned the research on mRNA vaccines. What made this vaccine different was the mRNA technology that had already existed, but Dr. Corbett converted it over and used it for COVID, and it worked. The reason that it felt that it evolved so quickly was called Operation Warp Speed. What would happen is we never had that many people apply for a clinical trial. The coffers were opened and we had availability of funding to run the trial, and it was quickly brought to the public, and it saved lives.
There you go. Now, we have seen some shakeups at the CDC right now, so some leadership is changing. Let's talk more about the resources we have here in our community. And, you know, if you're starting to feel confused, what is that first step of who you go to? Primary care provider?
Yeah, you go to your healthcare primary care provider. You ask them about availability and ask them about how it affects any of the conditions that you have. Let them know your specific situation and ask where. Then the next question is, where can I get a vaccine if I need a prescription from you? At that point, you should probably call your pharmacist, and they have the consultation window. You should go talk to your pharmacist about the consultation window, see if they have them available, ask what the processes are in order for you to do so. Ask your insurance company, is it covered? If not, how much will it cost? Those are the basic conversations between your healthcare provider and your pharmacy.
But put this into context about how serious this is, because I think there's a lot of fatigue around COVID-19 as well. And so, you know, should we still care about COVID? What do the numbers show?
Yeah, so the numbers are showing we're surging right now across the country, particularly here in Louisiana. The wastewater surveillance is showing that we are peaking and spiking right now. But this is normal because this is the normal summer-fall surge that we see. There are two strains out right now, and they're from the Omicron family. And the virus has evolved to give you that sore throat. They talk about the razor blade throat, nasal congestion, and all the things associated with COVID. The symptoms are milder, but it's still a very dangerous disease. I do know of one death, not in our viewing area, but very close to where we are from COVID, and because the numbers are surging. So this is still a very serious disease that we need to protect ourselves from.
All righty, no guards down. Thank you, Dr.